In today's health headlines, it's Heart Month, what you need to know about cholesterol, how emotional stress can affect your heart, and tips for improving your heart health. Joining us today is Dr. Joyce Unshaw, Yale Medicine cardiologist and Associate Professor of Medicine at Yale School of Medicine. Welcome to you.
Thank you so much for having me.
All right, we all know that high cholesterol is a health problem, but not everyone knows why. What can you tell us about this?
Yes, so cholesterol is a waxy fat-like substance that the body actually needs to perform some of the body functions. However, when the cholesterol gets too high and the cholesterol level is circulating in the bloodstream too much, that cholesterol can actually deposit onto the heart arteries and all the arteries in the body, causing plaque to build up. And then that can lead to different things like stroke and heart attack and kidney disease. There are two types of ways that you would get cholesterol. One is from genetics. So your body makes cholesterol, and the other one is what you eat. So doctors will check a lipid profile, basically, which will look at your total cholesterol, your LDL, which is the bad cholesterol, the HDL, which is the good cholesterol, and the triglycerides, which is a building block for the cholesterol. And from that, they can determine your cardiovascular risk. However, there are actually some newer labs that you could also check to determine your cardiovascular health risk, and that is the non-HDL cholesterol and the lipoprotein (a). Those two labs actually will help to look at the amount of inflammation in your body. So your goal LDL will depend on your risk. So patients who have had heart attacks before or who have had diabetes, they need a lower level of the cholesterol compared to other people. And the one thing that you could also ask your doctor for low to intermediate risk patients, so you've not had diabetes or heart attack, is to get a calcium score, which basically takes a CAT scan picture of your heart arteries to see how much calcification you have. And if there is a lot, then we want to really treat your cholesterol level.
All right, all good information. And some experts say that stress is a risk factor. Tell me about that.
Yes, so we all have experienced stress, and everybody handles stress differently. So some patients actually will have a little bit of deleterious risk to their bodies cardiovascularly. So long-term stress can actually lead to increased inflammation in the heart arteries. This can lead to increased plaque deposition of that cholesterol that we were just talking about. In addition, when people have a lot of stress, the catecholamine surge rises, and so that's our fight and flight hormone, and that can lead to high blood pressure and high heart rate. And those two vital signs, if they are elevated, can lead to other issues like heart failure and high blood pressure and even stroke. And the last thing is that stress can also lead to arrhythmias sometimes.
All right, and just real quickly, improving our heart health, what are quick ways to do that?
Yep. My number one thing is to know your numbers. Know your blood pressure, your cholesterol, your blood sugar, your weight. Get those down to the goal that you discussed with your doctor. The other thing is very simple, keep moving. Don't stop moving, continue to exercise. The American Heart Association says we need to do moderate exercise for 150 minutes a week. So I like to tell patients 5 30-minute sessions. The other thing is watching what you eat. Try to cut back on the carbohydrates, the sugars, the fried fatty foods, and try to eat more vegetables and lean proteins such as fish and chicken. And then the last thing is if you smoke, you want to try to quit smoking if you can.
All right, thank you so much, Dr. Unshaw. Take good care.